this nicotine product standard could save more than 4.3 million lives.
A new and long-awaited rule from the Food and Drug Administration that hopes to bring smoking in the U.S. to an end.
And I got lost in the car and I didn't know where I was.
The number of Americans with dementia is expected to double in the next 30 years.
She is looking at life before cancer and after cancer, and it's about what's really important to her and phasing her return.
And Princess Kate visits the London Medical Center that helped put her cancer into remission. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Bradley Blackburn. We begin with a new report from the American Cancer Society that shows an overall decline in deaths from cancer. But incidents are rising for certain populations, specifically women and young adults. Here's CBS's Michael George.
3 years ago, Tiffany White was diagnosed with endometrial cancer, a type of uterine cancer. She was 28 years old.
For years, I was actually misdiagnosed. So I would go to the doctor often and have these really chronic menstrual cycles. And no one could figure out what was wrong.
She had 6 surgeries, radiation, and then suffered a stroke.
When it was over, I'm in menopause at 31. So a lot of the things that other people my age are experiencing, I can't experience. Can't carry children. And so emotionally, it has been a roller coaster.
While overall death rates for all cancers are declining thanks to early detection and treatment advances, the American Cancer Society says progress is being threatened by increases in several cancers, including uterine cancer, especially among women and younger adults.
Really striking in this report is an increase in the number of women being diagnosed with cancer in the 50 to 64 age. It's particularly striking in younger women.
Rates in women under 50 are now 82% higher than men. The report also highlights death rates rising for oral cavity, pancreatic, and uterine cancers.
Uterine cancer, it's a cancer with a very large disparity in outcomes between Black and white Americans. It's a cancer because of the importance of estrogen driving it, that there are also links to obesity, but there aren't deep population-based studies that we can say that for sure.
So someone is not listening to you, go to someone else. If I had not gone to multiple doctors, I probably wouldn't be sitting here talking to you all today.
Tiffany says she hopes sharing her story raises awareness and encourages others, especially Black women, to advocate for themselves. Michael George, CBS News, New York.
Lung cancer remains the leading cause of cancer death, most often associated with smoking. Now the FDA is proposing a limit for the amount of nicotine in cigarettes and tobacco products in order to make them minimally or even non-addictive. The proposed rule would set a maximum nicotine level allowed in those products.
Smokers become addicted to cigarettes because of the nicotine. It is one of the most addictive substances known to man. We also know that the vast majority of smokers want to quit. The problem is they are so addicted to this substance. And so if you reduce the level of nicotine in cigarettes to minimally addictive levels, you're going to make it far easier for smokers to quit.
If finalized, FDA research says it could save more than 4.3 million lives over the next 75 years. Tobacco use among kids in middle and high school is at a 25-year low. According to the CDC, the use of tobacco products is the leading cause of preventable death and disease in the U.S. The FDA has also just banned the dye called Red 3 from the U.S. food supply. That, too, has been linked to cancer in several animal studies. The dye can be found in foods including some candies and maraschino cherries, as well as supplements and oral medications. Red 3 was barred from cosmetics nearly 35 years ago because of potential cancer risk. Consumer advocates from 24 groups filed a petition in 2022, citing research that found the dye causes cancer in lab rats.
Over 3 decades ago, a series of industry-conducted studies in rats clearly showed that this chemical, Red 3, was associated with thyroid cancers. And the law is also clear that when a chemical causes cancer in humans or animals, it is not supposed to be in the food supply.
Food manufacturers have 2 years to remove the dye from their products. Drug makers have 3 years. For the first time ever, the Environmental Protection Agency is warning about forever chemicals, or PFAS, linked to cancer in fertilizer containing sewage sludge. Some farms spread it over cow pastures, and a new assessment by the EPA says it raises the risk of cancer by, quote, several orders of magnitude above what the EPA considers acceptable. The PFAS enter wastewater systems through drains, and treatment facilities cannot effectively remove them. The EPA says those most at risk are people who regularly consume milk, beef, and other products from those farms. Organic farms are not allowed to use the sewage sludge. Britain's Princess of Wales, Princess Kate, says her cancer is now in remission. The future queen went through months of treatment last year. Most of the details remain under wraps, but as CBS's Imtiaz Tayeb reports, she made her announcement after an emotional visit with other cancer patients in London.
In her first royal outing of the year, the Princess of Wales visited the very same cancer hospital she received her own cancer treatment. Kate thanked the medical staff and sat with cancer patients, later revealing on social media she is now cancer-free. It is a relief to now be in remission, and I remain focused on recovery, she said. As anyone who has ever experienced a cancer diagnosis will know, it takes time to adjust to a new normal. Roya Nika is the royal editor at the Sunday Times newspaper.
I think that phrase new normal is really significant. She is looking at life before cancer and after cancer, and it's about what's really important to her and phasing her return and prioritising family and time to recover.
The surgery was successful. However, tests after the operation found cancer had been present.
Kate's cancer was first detected a year ago after she was admitted to hospital for an abdominal surgery. She completed her treatments last summer, but the palace has never confirmed the type of cancer she had or how far it had progressed. The princess's remission will lift a major cloud from over the royal family, which is still coping with King Charles's cancer diagnosis, announced just days after Kate's. I'm Imtiaz Tayeb in London.
The risk of developing dementia in the U.S. is much higher than previously estimated, according to a new study. It finds cognitive decline will double by 2060 and impact about 1 million Americans a year. Here's CBS's Stephanie Stahl.
Karen and Anthony Sandone say they were living the good life until he was diagnosed with early onset Alzheimer's when he was 55.
And I got lost in the car and I didn't know where I was.
In addition to some memory loss, Anthony had trouble finding words.
When you heard that diagnosis, what did it feel like? What was it like?
Man, like a truck hit me.
It was very devastating.
Yeah, it really was.
Now they're working with the Alzheimer's Association to raise awareness about the memory-robbing type of dementia that's growing. New research says dementia numbers will double over the next 35 years.
So the lifetime risk is very high.
Study author Dr. Joseph Korish with NYU Langone says the study found the lifetime risk of developing dementia for people over the age of 55 is 42%. That's considerably higher than previous estimates based on newer information.
This study looked at 15,000 people followed since the late 1980s.
Dr. Korish says the risk goes up with age, especially after age 85. And he says the research highlights the need for more preventative measures.
The things that prevent heart disease, like low blood pressure, no diabetes, no smoking, and then physical activity, sleep. Then later there's a lot more hearing loss, and I'd have people address hearing and vision loss and avoiding social isolation.
The Sandones say it took 2 years to get the diagnosis. With early onset, there are medications that can slow progression, which Anthony is taking.
So we do think that it's helping, and we're certainly grateful that he was a candidate.
Celebrating 15 years of marriage and hoping for many more. Stephanie Stahl, CBS News, Philadelphia.
New research has linked a higher risk of dementia to eating processed red meat. Here's CBS's Dr. Malika Marshall.
Beef, pork, lamb. The U.S. is one of the largest consumers of red meat in the world, and it's putting us at higher risk of health conditions like heart disease and type 2 diabetes. Now researchers have found a direct link between processed red meat and dementia.
Processed red meat.
Dr. Daniel Wen is a nutritional epidemiologist at Mass General Brigham. He and his team looked at the dietary habits of more than 133,000 health professionals, specifically on their consumption of both processed red meat, like bacon, hot dogs, and sausages, which contain high levels of salt and preservatives, and unprocessed red meat like steak and ground beef. They found that those who ate the most processed red meat, on average a quarter serving per day or more, had a 13% higher risk of dementia compared to people who barely ate any.
We found very consistent evidence that higher processed red meat intake is associated with higher risk of dementia.
The same level of risk was not found among people who consumed higher amounts of unprocessed red meat, though people who ate either unprocessed or processed meats were more likely to self-report problems with memory loss and cognitive decline.
If you can try to decrease your red meat intake, especially the processed red meat intake, at any time point during your life, that will help your cognitive health.
So if you're going to eat red meat, choose unprocessed red meat like the ground beef found in a hamburger, and of course, skip the bacon. The researchers also found that substituting red meat with nuts and seeds in particular, but also poultry, fish, and low-fat milk, can reduce your risk of dementia and preserve brain health. Dr. Malika Marshall, CBS News, Boston.
3 Borhead deli meat plants have been cited for unsanitary conditions, according to newly released federal records. Within the plants, federal investigators found insects, mold, and, quote, unidentified slime. The problems cited date back to 2019. The new findings suggest sanitation problems were not limited to a Virginia factory that was shut down last year. That followed a listeria outbreak that killed 10 people. Borhead officials told the Associated Press the violations, quote, do not meet our high standards. They added the remaining plants continue to operate under normal USDA oversight. In other food-related news, the FDA is proposing that companies add nutrition labels to the front of most packaged foods. If finalized, consumers would be able to see a product's fat, sodium, and added sugar, and specifically whether levels are low, medium, or high. Consuming too much of those nutrients has been linked to chronic diseases. There are new recommendations to measure obesity that could change whether some people are classified as obese. A report published in the journal Lancet Diabetes and Endocrinology focuses on body fat and what medical issues people have, not just their weight. Instead of just using BMI or body mass index as a way to diagnose obesity, the authors want BMI to be a first step to determine who should be tested for excess body fat.
The main takeaways is to get away from solely using body mass index to diagnose obesity, to add another measurement of body size, which more directly assesses body fat. And once we have that identification, then separating out individuals who are leading a good life, with good quality of life, no impairment of their health. They have a preclinical obesity, but if their health is impaired or they have reduced quality of life, they transition up to clinical obesity.
New data released by the Centers for Disease Control and Prevention revealed the largest drop in overdose deaths ever recorded in the U.S. over a 12-month period. Between August 2023 and August 2024, overdose deaths decreased by 22%. The CDC's number of predicted overdoses is the lowest it's been since August 2020 and comes after overdoses peaked in the summer of 2023. White House drug czar Rahul Gupta told CBS's Nicole Skanga real progress came after U.S. drug enforcement started going after not just drug cartels, but also the middlemen.
Do you feel like we're out of the woods?
Not really yet, because here's why. We still have over 90,000 people that are still dying every single year. So we have our work cut out for us as a nation.
And while overdose deaths are down overall, some states are still seeing an increase, including Alaska, Utah, and Nevada. A wave of norovirus infections this winter has reached levels that are now more than double last season's peak, according to the CDC. During the first week in January, more than a quarter of norovirus tests came back positive for the highly contagious stomach bug. The virus can spread easily through contact with an infected person, ingesting contaminated food or water, and touching contaminated surfaces and then touching your mouth.
People can even be contagious up to 2 weeks later, even if their symptoms have resolved.
Experts say hand sanitizers do not work on norovirus, only soap and water, and it can live on surfaces for days, so it's best to use bleach-based cleaning products. The CDC has confirmed another case of bird flu in a child, this time in San Francisco. Officials say the child experienced fever and an eye infection, but did not need to be hospitalized and has since recovered. Health officials don't know how the child was exposed. In November, the CDC confirmed another California child had bird flu. The CDC says nearly 70 people have contracted the virus since it started spreading in animals last spring. A Louisiana man recently died after contracting the virus. Health officials say the risk to the general public remains low, and there's no evidence of person-to-person transmission. After the break, young adults are getting serious about their slumber, and we'll look at a social isolation trend that began well before the pandemic. Welcome back. Do darker days get you down? If so, you're not alone. About 40% of American adults say their mood worsens in winter when we experience less daylight. That's according to a poll by the American Psychiatric Association. And it could be something called seasonal affective disorder, also known as SAD. Symptoms include feelings of sadness and depression and a loss of interest in activities. Experts say light boxes and talk therapy can help, but may not be enough for serious depression.
I really want to encourage people, if they find that year after year, it seems to be this rhythm where, the darker days come and they get depressed, that's like, okay, seek professional help, okay? You don't want to just say, I'm going to go out and treat it myself, because it can be serious, and you can actually go all the way up to suicidal ideation.
But a restful night is also vital for health and wellness. Everyone loves a good night's sleep, but young adults appear to be prioritizing it more than older generations. CBS's Christian Benavidez looks at new ways many are maximizing their shut-eye.
Camilla Charles, a college senior in Florida, is among the millions of young adults who are now prioritizing their sleep routine in order to catch more Z's.
Magnesium, I go to sleep, I do my skincare, I'll put my hair, if it straightens, I'll put it in little rollers.
It's part of a trend known as sleep maxing, maximizing the time it takes to do your routine before going to bed so you can get more hours of sleep.
I'm trying to figure out what works for me, actually, because it is hard.
A room is dark. No television on, no nothing. You gotta be quiet, man. And freezing cold in my room.
One recent analysis found Gen Zers spend more time sleeping than any other generation. That same survey showed they also spent more time exercising and prioritizing self-care than others.
You just want to make the quality better, which is a good thing. So it's a concept of health versus illness. Optimizing your health versus not the absence of illness. So same thing with sleeping. Even though they may be considered good sleepers overall, they want to make their sleep even better yet.
While Gen Zers may be prioritizing sleep, a survey of all Americans found a majority, 57%, said they would feel better if they got more sleep. The American Academy of Sleep Medicine recommends 7 or 8 hours.
I slept so good.
On social media, some young people are going as far as taping their mouths shut, along with using nostril expanders.
A lot of things people do that are not necessarily evidence-based.
Dr. Rafael Pelayo with Stanford University warns against obsessing over those popular sleep trackers on smartphones. And if you're having trouble sleeping, it's best to consult your doctor. Christian Benavidez, CBS News, Miami.
The number of Americans who are socially isolating is growing, and it's not just a holdover from the COVID-19 pandemic. That's according to journalist Derek Thompson, who appeared on CBS Mornings Plus to talk about his article in The Atlantic, The Antisocial Century. Thompson says even before the pandemic, people were increasingly choosing to spend time away from others.
But chronic loneliness, being alone day after day, being alone more year after year, that's a real problem. That tends to correlate with much less happiness and with serious problems both for individual health and I think for community health. And what we see in the data is that Americans aren't just spending more time alone year after year, decade after decade. There's actually never been a period in recorded history when Americans have spent so little time doing face-to-face socializing and so much time being alone. I mean, that's according to official government records.
A survey of high school seniors going back to the 1970s shows time spent with friends started plummeting in the 2010s when smartphones became ubiquitous.
But one thing that I think our devices, our phones, our screens do is they make our alone time more crowded, because when we're alone, what do? We pull out our phones and we spend time in the minds and crowds of other people, which are often very anxious, often very angry, often very negative and emotional. And sometimes when we're in a crowd, what do? We feel a little bit of social anxiety, we pull out our phones, and suddenly we're alone. So in a weird, almost paradoxical way, our alone time is more crowded than it used to be, and our time in crowds is more lonely than it used to be. And this makes it harder, I think, to have true social connection.
Thompson says his research shows the solution needs to be community-based. For example, if your friends are having more dinner parties, it's easier to plan another dinner party. Coming up, how to protect your eyes in the winter when temperatures drop and the air is dry. Welcome back. Arctic air from Siberia is expected to hit large swaths of the U.S. in the coming days. In North Dakota, forecasters say temperatures could dip to -17 degrees. And even into the south, lows could be in the 20s. Some folks might choose to hibernate, but if you like to stay active, you may notice the brutal cold can make your eyes water. CBS's Jeff Wagner looked into why our eyes tear up.
Fresh flakes falling.
It's nice to have some natural snow on top.
Keeps the ski trails busy at Theo Wirth Park in Minneapolis. The January sun wasn't to be found, but eye protection was still a popular choice.
Just to kind of keep things warm, keep the wind down.
Otherwise it can really hurt and kind of make you tear up after you're done with your workout.
An accessory Nick Partington regretfully skipped.
I should wear glasses with the snowflakes because when they get in my eyes, it kind of stings.
Why does cold weather make our eyes water?
Our eyes are really smart, and they're trying to keep your eyes as moist as possible, so they'll keep on tearing as long as they sense that dryness.
Dr. Sasha Struhl is a pediatric ophthalmologist.
Is there a certain temperature threshold for when this occurs?
Not so much a temperature threshold, it's more about when the dryness comes in.
Minnesota's cold winter air tends to be dry, which is why our eyes water more now than during the humid summer months. Conversely, your eyes might water on a breezy July day in Arizona, since the climate is dry year-round.
So our eyes really have two forms of tearing, one that's reflexive to when we feel our eyes are dry, and one that's just our baseline tearing.
Basal tears constantly keep your eyes lubricated and protected and have oil and mucus in them. Reflex tears, the ones that flow to combat dry air, are mainly water.
And so even though it's trying to moisturize our eyes, you can imagine if you put your hand into water, it's not going to moisturize your hand as much from the dry weather than if you put it in oil or lotion.
One might think skiers, ice anglers, and others who spend lots of time outside in the winter might build up a tolerance to dry air, but Dr. Struhl says it doesn't work that way.
The best thing you can do is actually improve your tear health so it's less of an impact on you. The oil part of our tears comes from our eyelid glands. And so doing warm compresses for your eyelids, kind of giving yourself that spa treatment at night can actually improve how we produce our oil, and our tears can actually be healthier.
Using eye drops, specifically artificial tears, will replicate healthy tears and better add moisture. There's also ointments you can apply to your eyes before going to bed. Lastly, eye protection.
I like to use these type of lenses for days where it's more overcast to help you see the snow better.
Glasses and goggles keep snow and wind at bay, giving you a tear-free day on your next winter adventure.
These are prescription, so I always have glasses on.
Jeff Wagner, CBS News, Minneapolis.
And that's Eye on Health for this week. I'm Bradley Blackburn. Thanks for joining us, and be well.